Today we'll be discussing lateral ankle sprains. Typically, the ligament that is sprained the most is ATFL, anterior talofibular ligament. The joint that is responsible for moving your ankle and foot up and down is the subtalar joint. So later I'm going to discuss some exercises that can help free up this joint that normally gets locked up when this ligament gets injured. So for this exercise, we're going to be working on the subtalar joint right here. And that's going to allow us to be able to pull our foot back better. And that's one area that is limited for people that have an ankle sprain. So what you want to do is place your foot close to the wall, and you're going to bring your knee with your heel down to touch the wall. And if you're restricted, you're going to feel some tension, tightness in this front of your ankle here. That's a subtalar joint. If you do not feel the restriction, you want to bring your foot, slide it back just a little bit further, and then try it again. You get to the wall and you don't feel anything, slide it back again, and at this point you may feel it in that joint. So get as close as you can and hold it there for 5 seconds, and then come back off. You want to repeat that 10 repetitions for a 5-second hold, and that's going to help your subtalar joint gain the mobility it needs when you walk to take a nice stride. And the important thing about this is making sure that your heel stays on the floor. If your heel lifts up off the floor, then get closer to the wall. And that is another sign that your calves are too tight. This next exercise is going to address your calf tension. Place your forefoot at the edge of the step. This is about a 4-inch step. My heel is down, knee straight. That's going to stretch your gastroc muscle. You want to hold that for 30 seconds to a minute. And then after that, you're going to transition to the soleus muscle. The important thing on this one is that you slightly bend the knee, and that puts slack on your gastroc muscles in order to facilitate more of a stretch in your soleus, which is deeper to the gastroc muscle. And you want to hold that also for 30 seconds to a minute. Once you're done with that one, return back to the gastroc. And then one more time for soleus. I typically do about 2 sets for this, of each. Okay, now we're ready for some strengthening. So first, we're going to work on pressing the gas pedal. This you want to do for 15 to 20 reps. And this one might be the easiest of the 4 directions we're going to be going over today. So the bend here might be a little heavier than the rest of the directions. The next direction we're going to do is coming out laterally. So holding the band out to the side and going in and out. 10 to 15 reps. Then moving into the other side, come inward. Now we're going to work pulling towards you. So pointing the foot down and bringing back towards you. 15 to 20 repetitions. Now for a little bit more advanced move, it's going to be a heel raise with 2 feet. Dropping the heels below parallel and raising them above parallel. Up and down. 10 to 15 reps to start off with. Work your way to 20. Once 20 becomes easy, try it single leg. It helps to hold on to something stable while you do this. It's not a balancing activity. Next, we're going to work one side of the leg. So we're going to do 2 legs at a time, and then bringing your feet below parallel and above parallel. Toe raises. So we did heel raises first, now toe raises. Same thing, 10 to 15, work your way to 20. Once that becomes too easy, then single leg for more of an advanced move. Next, we'll be addressing the soleus muscle, which is deep to this outer calf muscle called the gastroc. If you reflect it, underneath it, there's another muscle called the soleus, and it runs down, also attaches to your Achilles tendon. So one way to exercise that one is with your knee bent at 90 degrees, raising your heels up and down, below parallel and above parallel. Once that becomes too easy, you want to add some resistance, choose a weight that's appropriate for you, start off lighter, and then work your way up. This next exercise is for joint mobility of the ankle. This is called ankle ABCs. So as easy as it sounds, just draw the alphabet, uppercase, all the way from A to Z, and that will help with the mobility of the subtalar joint and some of the other smaller joints that surround the ankle. Stability is normally compromised during an ankle injury, so we also want to focus on balance. So single leg balance, you can get close to a wall or some type of chair, something sturdy, and work on the stability of the ankle in a neutral position, flat floor. Once that becomes too easy, you can get a foam or a pillow, something unsteady underneath there, and progress onto a more unsteady surface. So you want to work on getting up to 30 seconds at least, and then progressing on if you need to a different, harder surface. Thank you for joining in today. I hope your ankle mobility and strength improve, as well as a decrease in pain. Thanks again from the Mechanic Shop.